Hi, everybody. I'm Leah Lund, and I want to welcome you to this episode of Reboot Your Brain. We are here today with Dr. Kat Toups, and Kat is a functional medicine psychiatrist, and in particular, specializes in helping reverse mild cognitive impairment and also early signs and early onset dementia. And so, Kat, I just want to welcome you. You have been a great resource for me over the years and for the Neuronutrient Therapy Institute. And I'm just so excited to bring you to our audience here on Reboot Your Brain. So thank you so much for being here.
Likewise, thanks so much for having me.
Yeah, so I know you have an incredible story, and I really want to start there because the question is really, how did you come to decide to have your career in the functional aspect of psychiatry, and particularly in the area of working with dementia and cognitive function? So would you mind sharing a little bit about your story?
No, not at all, not at all. I know now that the path that I came to functional medicine with, I walked through this path, I think, to be able to share that story and help other people believe that there's ways to get better. So I was about 50 years old when I started really having obvious problems with my brain and really exhibiting signs of dementia. And at that time, I was running a clinical trials research center. I was doing studies with all kinds of psychiatric medication. That's what I believed and was trained as the way to help people, was to take medication. And in particular, one of my areas of specialty was Alzheimer's, dementia, and mild cognitive impairment. And I did 20 clinical trials in Alzheimer's. All of the drugs that are out there I've worked with in clinical trials, but I work with many drugs that failed. And, even the ones that are out there have very limited usefulness. Right? They can help maybe slow things down for up to a year, but after that, they're not curing the disease. So I was doing clinical trials with Alzheimer's, and I started to realize that I was as cognitively impaired as my patients. And I would give them 3 words to remember. So I would test them on a mini mental status exam, and you give them 3 words, and then you ask them the words a little later. I couldn't remember the words, and I would have to write them down so that I could ask my patients the words. So that was a big clue to me that things weren't working. But it really progressed to the point that I couldn't learn things. I couldn't remember things. I couldn't do anything on a computer. I would ask my husband, Dorian, could you show me how to do this? Things that I had forgotten. And he would get mad at me because he'd say, I just showed you that. And I couldn't remember that he had just showed me that. I had trouble. I had trouble driving a car. My processing speed was so impaired. My husband got in the car with me one day and he said, Kat, what's wrong with you? You're like a little old lady. And I said, I don't know. So many things happen when you're driving so quickly, and I just couldn't integrate them very well. I probably shouldn't have been driving at that point. I lost the ability to back up the car or parallel park. I couldn't do it. I would try to parallel park. I would try over and over. I couldn't get that visual spatial thing right, and I would give up. I developed auditory processing problems, and I could not decode what was being said by people. So I kept going to my ENT and saying, I need some hearing aids. And they would say, well, you just have a mild hearing loss. It's not enough to cause problems. And one day the ENT looked at me funny and he said, this isn't in your ear, it's in your brain. And they tested me, and I had developed auditory processing problems. So I couldn't decode what was being said. So it was quite a path. But the reality was I had developed multiple chemical sensitivity. I had become allergic to everything. I was highly inflamed, was covered with rashes and hives. So all that inflammation was coming out in my skin, but it was not only ravaging my body, but it was ravaging my brain. And so that was, causing the cognitive symptoms for me. So it was a 3-year journey of getting well and working through all kinds of layers. And I went to a conference called Food is Medicine, and that was an epiphany for me. I thought I ate healthy, but the notion of that food can really, turn on genes and turn off genes, and can really heal us in such magical ways. that really opened my eyes. And they kept talking about IFM, Institute for Functional Medicine. I said, what is that? So I Googled that. Their next module was the immune and allergy module, and I of course needed that myself. So I went there with a sieve for a brain, but that started my functional medicine path. So I worked through every module in functional medicine on myself, and came out the other end, got my brain back online.
Wow, so I can't even imagine. I mean, you're there working in the field of psychiatry, working in the field of the brain, studying Alzheimer's,
Right.
and then this begins to transpire. And you mentioned a 3-year journey to healing. What kind of a time span was it that these symptoms were appearing? Was it a quick thing, or was it that over a longer period of time? Because I assume it kind of worsened, you know.
Right. It was insidious. I had immune problems on and off through my life.
Okay.
And, I think that as we shift to thinking about, the topic for today about working with dementia, and it's the same thing with dementia or any chronic illness. It's never one thing, right? It's all kinds of things. And, we're looking at, you might have one straw that breaks the camel's back. So something happens to someone and that triggers something and they manifest, major illness and can't function. But looking at all of the factors that led up to that point of breakdown of the system, that's how we also begin to heal people, right? We need to look at multiple factors all at once.
Yeah, I think it's Dr. Sears, I might be wrong on this, says there's no such thing as a sudden case of cancer. So it's much the same with our brain. Yeah.
Right.
Well,
exactly.
So can we start at the beginning? And I want to come back to food for sure. But let's start with really defining, if you would, what dementia is.
Well, dementia is just any loss of functioning of your brain to the point that it's affecting your functioning. So, it's a spectrum with dementia, and Dale Bredesen, one of the pioneers of bringing the message of functional medicine dementia to the world, talks about subjective cognitive impairment. So clinical terms, we have mild cognitive impairment, to where you have enough loss of capacity in different areas that it's starting to affect your functioning, but it's still not a major problem, and on into regular bona fide dementia. And we have rating scales that will say, okay, when you get to this point on the rating scale, now you've crossed over into dementia. But there's also subjective cognitive impairment. And that's when you think something is wrong. And, many people have this subjective feeling, perhaps when they get in their 50s, like their brain is just not the same. They're not as quick. They might have trouble finding words. They might, they're just not retrieving data as well. And they go to see their doctor, and their doctor says, no, you're fine. This is just aging. And from my world, actually, I think we need to listen to those little warning signs. If we think something's wrong, that's when we really need to start, looking at, okay, what is happening with our health, and from all these different areas that, we can talk about different areas that affect the brain. So just dementia is any loss of functioning in your brain, and it is this whole spectrum of illness. But one thing that I like to tell people about dementia is, okay, dementia is a neurodegenerative disorder. It means things are degenerating in your brain. They're breaking down over time. But it's not a mysterious thing that just happens. People say, okay, I got Alzheimer's. Well, no, it didn't just happen, as you mentioned with cancer, right? It is a path of things happening over time, and it happens for reasons. So there's multiple reasons that can cause the brain to degenerate, and they can be, we've known a long time for metabolic reasons like vascular dementia. If your lipids are bad and your blood sugar is bad, you'll destroy your blood vessels, you'll destroy the blood flow to the brain, you'll degenerate that way. We know that toxins, chemical toxins, metals, lead, mercury, aluminum, all of those things that are getting, unfortunately, so ubiquitous in our life, many of those are neurotoxins. They're going to degenerate the brain. When you lose your hormones, we could say more about that, but hormones are a magical thing for our brain. And when we go through menopause, and as women, and men go through andropause, and they lose their hormones, they just lose them a little more slowly and a little bit later in life normally. our brains don't function as well. And if we look at most of evolution, we didn't live that much past menopause, so it sort of didn't really matter, but now we can live half our life after menopause, in this day and age. And so it turns out that our brain has receptors for estrogen, for progesterone, for testosterone, for pregnenolone, for DHEA. All these hormone receptors are not only in our gonads, our sexual organs, but our brain is full of those receptors. And interestingly, the brain can make its own estrogen and its own progesterone and its own testosterone. That's something I only just discovered quite recently. It's not well known.
Yeah.
So our brain should be making some hormones, and we have receptors for hormones. So when our hormones go away, what happens? Those neurons start degenerating. And so, that's one factor. As we look at all the factors to dial in, how can we help people's brains? That's one that's not so difficult. Get the hormones all in balance, and sometimes that's just magical for people. It can reboot their brains so quickly when they get their hormones right. So we got toxins, we got hormones, we got metabolic issues, and we know stress and depression actually can degenerate the hippocampus, which is our memory centers. And a big thing that I want to also highlight is infections. So this is something that I think a lot of people are missing with the brain, and it's starting to come out more and more, but all kinds of infections and viruses affect our brain. And one of the biggies in our world these days is Lyme disease. And, Lyme has just kind of been bastardized, and, is it real? Is it, I don't, it's kind of crazy how it has been looked down upon, but Lyme is a spirochete just like syphilis. And I think most of us know that syphilis can eat up your brain, and it's been mostly wiped out, though there's been some resurgence lately. But in the 1800s, a man would get syphilis, or the early 1900s, before antibiotics, and they'd have some STD, and it would go away, and then 10 or 20 years later they'd go crazy because their brain was eaten up with the syphilis. Well, Lyme does the same thing, and it can do it more quickly.
Wow.
But there's other infections besides the Lyme as well. So some of the co-infections with Lyme, the Bartonella and the Babesia, can have major central nervous system effects. They can cause psychosis. I mean, there was a report that just came out recently of, I believe, a 14-year-old child who was diagnosed with schizophrenia and was on antipsychotic medicine for a year and a half. And then some astute physician noticed that he had the stretch marks that come with Bartonella and tested him, and the child had Bartonella. They treated the Bartonella. The psychosis is gone.
Wow.
So that child would have been relegated to a lifetime of psychiatric medicines, disability. Yeah. The medicines themselves can, cause disability, metabolic syndrome, things like that. So I think looking hard for the infections it's an important part for people that are having cognitive problems.
That is so helpful and so powerful for people to know, and to know to ask, because if you're not being asked, what I'm hearing you say is bring your own possibilities to the table and ask for that kind of testing if you're exploring what's happening with your cognitive function.
Yes.
So is there a distinction at all between, so you mentioned like menopausal, and I hear this all the time from clients and women that are in perimenopause, that, they feel like they're losing their memory or their function. We kind of joke about, senior moments and that sort of thing as we age. Brain fog is a term that's used a lot. Is all of that really dementia, or is there a distinction?
Well, so there's a spectrum, right? As we mentioned, of cognitive issues.
Yeah.
So that's not frank dementia, but those are those warning signs, the subjective cognitive impairment. So, if we live past 85, you have a 50% chance of having dementia. And not all women have cognitive problems as they go through the menopause transition, but lots of them do. And I know myself, when I started having word finding difficulty in my early 40s, and went to my doctor, and I was also having like killer premenstrual migraines that were unusual. And she tested and she said, this is the start of perimenopause. And she said, word finding difficulty. I remember this so well. Word finding difficulty is pathognomonic of menopause. Pathognomonic means it's a central feature of that. So I went home and I'm like, oh, okay, this is perimenopause, right? And that comforted me for like half a second, because I
Yeah.
was an Alzheimer's researcher, and I'm like, okay, wait a minute, 50% of us are going to get Alzheimer's if we live long enough. And so maybe those of us that are having this word finding difficulty early in life are going to be the ones, and sure enough, as I racked up more and more insults to my body and my brain, that was a factor. So I think we should really look at that, and the data coming out with hormones now is actually quite lovely with the bioidentical hormones. I mean, the big concern is cancer. And hormones can feed a cancer if you have a cancer, but the hormones themselves don't cause the cancer. It's the diet and lifestyle factors that cause the cancer. And these days now, there's a couple of studies that have come out with the bioidentical hormones showing actually that they seem to diminish the risk of breast cancer in women that have already had breast cancer. So I find more and more of the OBGYNs and the cancer surgeons in my area here in the San Francisco Bay Area actually are accepting of my patients being treated with hormones even when they've had breast cancer, because it does seem like it's actually going to help their risk and not hurt their risk.
Oh, that's really great information.
Yeah.
Yes, that's terrific. So is this a genetic occurrence? Is dementia genetic?
Yeah. So dementia is multifactorial, and there is a genetic component.
Okay.
There's probably more than one genetic component. The big one we know about is with the ApoE4 gene, and ApoE4, it's apolipoprotein E, and it's a type of like when we measure people's lipids, it's a type of lipid, and it definitely does increase people's risk for dementia. That said, you could have two ApoE4 genes, and if you play your cards right and, keep your diet clean, your nutrients clean, your hormones right, deal with your infections, deal with your toxins, nobody should have to get, Alzheimer's with an ApoE4 gene. So I like to tell my patients really, the utility of that is just to know that you have some risk, that you're doing the right thing by paying attention to your diet and lifestyle now to help mitigate that risk. Mm-hmm. So it is slightly higher with the E4 for people. The real risk and the utility for me about knowing about the E4 is it's an interesting gene. We call it the fat bucket gene. And so when you have an ApoE4 gene, you tend to store all of your fats in your blood vessels and in your body. So people that have an ApoE4 gene are definitely prone to having more lipid problems. And it was an interesting, I mean, there's always stories of why do we have genes, why are they propagated and conserved in our gene pool. So when we were primates and living up in the trees, one of the ApoE4 gene came when we first came down onto the ground as early man. And it's a pro-inflammatory gene. And so you tend to store everything as fats, and it also tends to cause a lot of inflammation. And for early man, if they got, wounded by a predator or cut by a stick, they needed that inflammatory response to help them heal. So inflammation in the short term is helpful. We need that for our healing in different scenarios, but chronic inflammation on a long period of time is destructive. And so the ApoE4 gene does predispose to more inflammation, which can be mitigated by changing those epigenetic diet lifestyle factors, so that you're not expressing that. So it does help to just know that you need to be especially looking at lipids. And I think it would take me to another topic, which is some of the dietary factors that we're working with cognitive decline and dementia. One of the things that's been really helpful in the dietary department is ketogenic diets. And this can be a blessing and a curse sometimes with the ApoE4 gene. So the ketogenic diet is, we can burn we can burn glucose to fuel our body, or we can burn fat. And when we don't eat carbs and we don't eat sugar, then it will shift our body into burning the fats. And with a ketogenic diet, one thing is if you're doing that, you have to be taking in lots of fats so you have enough fuel for your body.
Yeah.
But when you shift into that fat burning, those ketone bodies in the brain have a very interesting effect, and they seem to heighten people's clarity of thinking. And so people will tell me, like, if they shift into a ketogenic diet, they know when they shift into ketosis because their brain just kind of wakes up in these interesting ways. So that's not a cure for dementia, but it helps the brain to function better, and to think better. And so
not a cure, just to interject for a second, and then I want you to continue, but not a cure, but preventative, would you say? Like, do you see ketogenic diet as a good way for most people to eat on an ongoing and preventative
Well,
basis?
I don't think it's for everybody. Let me say, I don't think any diet is for everybody. And so it's one of the caveats with the ketogenic diet is it's a high-fat diet. And so when you have ApoE4, we have to watch the lipids because you can see some people that will raise their lipids, and that's not a good thing. We don't want those lipids to get too high because it's inflammatory. But I've seen it go both ways. I've had some people with ApoE4 genes that eat ketogenic and their lipids go down. So again, there's no one size fits all. And not everybody can and should do ketogenic. I mean, there's people have other health issues and adrenal issues and allergy issues, and it's not for everybody. But people are exploring all kinds of things with ketogenic diets. I mean, that's a whole summit. People are exploring like intermittent ketosis. What if you did it a couple days a week? I think the important thing if we look to longevity, what helps people to live longer and extend lifespans, fasting is one of the biggest things. Calorie restriction, right? The more calories we eat, the shorter we live. The less calories we eat, the longer our lifespan. So kind of in addition to ketosis, or even apart from that, intermittent fasting actually I think is an easy thing for people to do that can be quite powerful. And by intermittent fasting, and so, we used to have people like fast 2 days a week and do 500 or 800 calories 2 days a week, and that's really hard to do. You can do it for a little while, but it's not fun and it's not easy.
Yeah.
But now that the data has gotten shows that it works really well to just fast every day. And if you can restrict your calories to 8 or 10 or even 12 hours of the day and fast the rest of the day, that will start shifting some people toward ketosis. And so that's kind of an easy way, the intermittent fasting, to have people help their brains and help their longevity.
Yeah, and when you say the day, the 24 hours, so that means keeping it into that, and then the nighttime and the sleep time can be the fast.
Right, exactly. Yeah. And you can shift depending on your tendencies. If you hate to eat in the morning, then you start eating at noon and, eat until 8 or 10 o'clock at night, and then, don't eat until noon the next day. That's going to be a fast. If you need to eat first thing in the morning, then you cut off your calories earlier in the evening. But it's not that difficult for most people to fast 12 hours. Some people are doing 14 hours. Some people are down to one meal a day, and that's sustaining them. But there's no one size fits all. Sure. If people do this and they feel horrible when their blood sugar is crashing, then that's not a good thing for them to do.
Yeah, or if it's not supportive for their neurotransmitters or something like that, they're having cravings, they're having mood shifts. Yeah, exactly.
And you fix other things before you could do that kind of diet.
Yeah. And maybe even first think about eliminating the sugars and the processed and the refined carbs and grains and all of that. Like there's layers and a spectrum to our eating also, isn't there?
Yeah. So, I mean, to me, that's like where you start with everybody, right? You have to, you can fix, don't even bother to fix your hormones and your toxins until you fix your diet, right? That's the foundation. We have to fix our diet. We have to fix our gut. We have to be sure we're eliminating things properly. And so I certainly ask all of my patients to stop gluten. That's kind of a minimum. That's the most inflammatory thing we eat. It perpetuates our leaky gut problems. And And, for the brain, it's actually better to think about going grain free. All the grains have high sugar levels. Wheat has more sugar than table sugar. The glycemic index is higher. So the sugar that you mentioned, we know that sugar is destructive to neurons. It's not an essential part of our food group. And
right.
Definitely, and controlling blood sugar. We've known for a long time there's type 3 Alzheimer's, and that's related to diabetes and poor blood sugar control. So controlling the blood sugar is absolutely essential for protecting your brain long term and all of your organs.
Yeah, wonderful. Yeah, really, it's there's a common sense, I think, element to this, that whatever is causing a metabolic issue and a problem within our body, why wouldn't it be causing it in our brain as well?
Absolutely.
Yeah.
There's not any magic line here, right? The
right.
blood vessels are communicating freely, and we've learned more and more about the gut-brain connection. So in psychiatry and mental health, that's such a powerful thing. But anything happening in your gut causes permeability of your gut, or what we fondly call leaky gut, and then whatever is in there starts diffusing through into your bloodstream. And then when there's things in our bloodstream, our blood's supposed to be sterile, so that activates our immune system, right? It says, oh my God, there's invaders, let's call out the troops. Well, the troops are making inflammatory cytokines to kill those invaders. And when those cross over through the blood-brain barrier into the brain, then in the brain, the immune cells are the microglia, and when they get turned on and activated, they just stay in their killing mode. They actually don't have an off switch. So once they're activated, they'll just keep churning out those inflammatory cytokines until they die, which is 2 to 3 weeks. And so when things are activated in the brain, it causes all kinds of psychiatric symptoms. And so one of the ways that I've learned in functional psychiatry now, that I've learned that, taking medications the way I was trained, that's not the answer, right? It's a Band-Aid and it might help people, but it doesn't cure the problem. So if we want to cure the problem, one of the ways that we start to help to heal the brain is to look at what is going on in the gut, and that's causing permeability of the gut, that's then causing inflammation in the brain.
Yeah. So autoimmune, would this be a fair statement that if there's an autoimmune issue present, that's almost like a warning sign or precursor in a way, a determining factor that it means you're at risk for dementia?
Yeah.
Or how would you say it?
Yeah, well, it hasn't been talked about that much, but I really do think that there's a strong immune component to dementia. And as we learn about, we know like Alzheimer's, you have amyloid plaques and you have neurofibrillary tangles. And all of the drug studies that I did were to wipe out those amyloid plaques. And we actually have drugs that will wipe out those amyloid plaques, but people don't get better. They did not translate to any clinical improvement, and none of those drugs are on the market. So that's not the answer. The answer is, why do we have those amyloid plaques? What can we do to prevent those amyloid plaques? Well, it turns out that secretion of the amyloid is a sticky substance that when there's trauma happening to our neurons, it secretes this amyloid that kind of gums up things to protect. But when you get too much of it, it destroys. So it's a protective response, and it's a response to, as we're learning about, infections and toxins. So there's things that are, causing that. And when you have an immune disorder, your body is attacking itself. So it's attacking organs, and the brain, is a factor of that. And many immune disorders are causing systemic inflammation. They're wreaking havoc, that we see high CRP levels, and that's a marker of systemic inflammation. And so that inflammation, again, is not just limited to your body. It is definitely happening in your brain. So controlling the immune factors is huge. And of course, in functional medicine, as you know, we are having great success with resolving immune disorders, and we do also always start with the gut. With that, we use a lot of low dose naltrexone, and I think that's been helpful for many of my patients with cognitive issues that do have markers for immune disorders. So I look at all kinds of things: immunoglobulin levels, natural killer cell levels, T cell levels, and you find that that those are all a problem. And then, of course, the job is, well, why? What is triggering those things? What is triggering the immunity? And autoimmunity can be triggered by infections. It can be triggered by toxins. It can be triggered by diet destroying your gut. Many factors there. So, the job with any of these kind of illnesses, any chronic illness can eat up your brain, and so it's how do you work with, reversing back the layers and working through all the layers that contributed to that illness. And I think that's the biggest important thing, is like you have to cast a wide net and look at a lot of factors.
Yeah.
Once, and that actually is how you can change things quickly. For me, it was a path because I had to learn things as I went. But now I can help people shift more quickly because I know what to test, what to look for, how to help them come at it from different angles at once.
So I have to ask the question, just so we're really clear, but looking at you right now, talking to me with all these facts and statistics and so knowledgeable, I feel like I know the answer, but is dementia curable?
Yeah, yes, it is. And it's an amazing factor. Like I said, I think I had to go through this path to learn it. I couldn't dial a phone number without getting confused in 2009 when I got sick. And it was a very clear day when I realized I could hold those numbers of the phone number and dial the phone again. And I said to my husband, wow, I can dial phone numbers again. And it's pretty scary when you can't dial a phone number. That's not good, right?
Yeah.
And my husband has ADHD, and he said, oh, I could never do that. He can't hold that phone number in his head, but I could, and now I can do it again. And it's a spectrum, and one of the important thing is, I think, for us to raise awareness that dementia, if we can get it early enough, it is reversible. And I had multiple reasons for mine. I had to work through all kinds of different factors to get my brain to come back online. But people go to see the neurologist, they get the diagnosis, and I tell them it's like a person, a tribal villager, goes to the witch doctor and he shakes a bone at them and he says, you're going to die. And they go off in the jungle and they die because they believe they're going to die. Mm-hmm. So we have to shift that perception, and we have to get people to believe that, okay, my brain isn't working, but there's reasons, and let me work hard to find all of those reasons and get them all back in balance, so then my brain can heal. Because we know our brains are plastic now. Neuroplasticity is a marvelous thing.
Yeah.
And when I went to medical school, we didn't know about neuroplasticity. We were taught at 18, those were all the neurons you were going to get, and it's downhill from there. But now we know, even at the time of death, they can do scans, metabolic like SPECT scans, and give people learning tasks. And they can see that even at the time of death, they're making new neuronal connections and are still learning things. So if we can take away all those things that are insulting our brain, then we can, and also, of course, give it the nutrients that it needs to heal. We didn't, there's so many things with food and, nutrient levels and B12 and vitamin D levels. And, there's so many clear things that are tropic for the brain and we need for the brain to function. But if we can find all of those factors that are driving it, yeah, we can reverse it. If it's really far along, I do work with some people that are farther along in their dementia, and we have halted it from getting worse. So past a certain point, you may not be able to get so much back, but if we can stop it from getting worse, that's success right there. That's better than, what most people are expecting. So yes, for people to understand, it's worth pursuing if you're cognitive problems. Get it before it's too late, because yes, it can be reversible.
Well, you are a shining example of that, because you are doing way more than dialing a phone number at this point. And it's so inspiring. And I just want to thank you from the bottom of my heart for having you here on this series and sharing this, because this is hands down the most hopeful conversation I've ever heard about dementia, and I think I could speak for our viewers as well. So in closing, is there anything else that you want to share with everyone listening in?
Oh gosh, there's always so many things
I
to
know,
share.
there's so many things I could ask you too.
I want to give a one-liner of some areas I've just been trying to research factors with mitochondrial support. Our mitochondria are the powerhouse cells in all of our body, in every cell of our body except our red blood cells that generate our ATP, which is our cellular energy. So we need ATP to drive everything. And we start losing that with aging, and by 50, it is going down. So there's a lot of cool, exciting stuff happening with how do we preserve those mitochondria, and how do we help them to make more ATP? And so any of those kind of things can help with neurodegenerative disorders. They're not curative, but they certainly can help functioning. And so I'll just give you some names, but I've been exploring, working with NAD, and there's IV NAD can be really helpful for regenerating more mitochondria, and has a lot of cognitive effects. And then learning more about some of the red light therapies and the low-level laser therapies. And one of my patients is having some treatments with a biophotonic laser type device, and has tremendous effects. They don't last that long, but this is a 51-year-old patient who has rapidly advancing frontotemporal dementia. And he has a treatment, and he has an immediate shift for a number of hours that it dramatically helps his functioning. So it's not curing anything, but it's changing its functioning. So working with these lights, we know that they are somehow penetrating and changing our mitochondria. So it's just kind of a new area, and lots more I hope will come out. And then even some of the stem cell work that's happening. And I have colleagues working with doing IV stem cells and having some changes in cognition. And so there's just some little new ideas on the horizon that I hope we'll hear more about.
Oh, me too. Me too. That's fascinating. And again, I thank you for being here, and really thank you for the work that you're doing, for being out there on the leading edge of this, because this is going to change the face of what aging looks like, and that affects everything and everyone. So
Yeah.
I just really appreciate you for the work you're doing, Kat.
Well, likewise, thanks for helping to spread these kind of messages. I'm working on a book to explain how to do this.
Yes.
And one of the chapters is dementia is not a death sentence. And that I really want, people to believe that, because we are seeing it happen, that we're reversing from all kinds of factors.
Well, I think anyone who listens to this will believe that. So again, thank you so much, Kat Toups, for being here. And for everybody who's been listening in, I'll see you on the next episode of Reboot Your Brain. Bye, everybody.
Thank you.